Hi everyone, I hope you will be doing well. Today we have come with this topic of PCOD or polycystic ovarian disease, which is also known as polycystic ovarian syndrome for you. This problem is very common. It is so common, especially in India, that in about every 5 to 6 women, one lady is suffering from this disease. So it's very common. Almost every third patient that we see in our IVF clinic is suffering from PCOD. So I hope this video will educate you about this and will be helpful for you. So if you want to consult at our center, the number is given at the screen and you can give a phone call and take an appointment. We have got 3 centers right now in Delhi. You can come at any of the centers, or if you wish to consult online, you can download My Follow Up app from the Google Play Store, and there my doctor ID is 659. All these links will be given to you in the description box. So now coming to today's video topic, which is PCOD. So what is PCOD? One more thing is that we would cover this topic. It's a huge topic, it's a vast topic, and we would cover this topic in maybe 2-3 videos so that it is easy for you to understand. So now coming to what is PCOD. PCOD is polycystic ovarian disease, where there are small cysts in the ovary along with lot of other symptoms, and that's why it is called as syndrome. It's not just one symptom, it's not just one problem, it's a syndrome of problems. So that's why it is known as polycystic ovarian syndromes. So first let us understand that why it happens. We don't know. The science doesn't know exactly why it happens. What science know till now is that it's a genetic problem. Somewhere it's a genetic problem. We don't know exactly what gene is involved, but it is a genetic problem, that's for sure. Usually it is found in families which have diabetes. So it is somewhere related to the diabetic gene. But only the gene itself, only the presence of gene itself will not lead to development of the disease. So that means genetic factor combined with some environmental factor, and which in most of the cases is obesity. Okay, so diabetic gene along with obesity combined together will lead to manifestation of polycystic ovarian syndrome. This is what we understand till now in science, and it is basically because of the imbalance of 2 very important hormones. One is insulin hormone and second is the male hormone or the androgen. Okay, insulin, as we know, is related to the diabetic gene. So what happens is, in those women who are carrier of diabetic gene, there the insulin is not working or not working actively, or their tissues or their body cells are not responding to insulin normally as they should. So this condition is known as insulin resistance. So even if there is a small amount of glucose, the body will have to secrete a lot of insulin to take care of that glucose. So that's why the insulin levels are increased in these women. So what does this insulin do? This insulin acts on the ovaries. Okay, so this insulin is acting on the ovaries now, and it encourages ovary to produce male hormones. Normally the ovary is producing female hormones. For the female, it's producing female hormones like estrogen and progesterone. But in the presence of insulin, hyperinsulinemia or high insulin levels, because the body has to secrete more insulin, it is producing more of male hormones, and that male hormone is creating all the trouble. This is what is the basic physiology of PCOD as we understand today in the scientific world. Okay, now coming to at what age the PCOD affects, or what age women would be affected. So the question is, it is in your genes. Whenever a female child is born, she is carrying that gene. So she has the disease since the beginning, but it will get manifested at puberty when the periods come. So some women will have the manifestation of the disease when they have their periods for the first time. Some women, it will develop a little late because of the addition of the environmental factors. So now coming to the symptoms. Suppose a young girl has come to us in adolescent. Okay, in the adolescent age group, there will be 3 main symptoms. One is acne. They are really troubled with pimples because there is so much of male hormones, and as we know, in the males there are a lot of sebaceous glands, lot of oil glands, and because of that the pimple formation is higher in such women. So one problem is pimples. The second problem is excessive hair growth, and the hair growth is of the male pattern type, like beard or mustache or hair on the upper chest and thighs. So hairy female. And the third problem is irregular periods. They usually get delayed periods. Sometimes the period don't come for 1.5 months, 2 months, 3 months, sometimes even 5 months, and sometimes they even have to take medications for periods. So these are the 3 very common symptoms in a young girl. So whenever a young girl has come to us with these 3 symptoms, pimples and hair growth and irregular periods, somewhere in our mind we start analyzing that this girl may be suffering from PCOD. Then we ask them the history, that do you have any diabetic family history? And then they tell us yes, their grandfather or grandmother was suffering from diabetes. Okay, so now when this girl has entered into the reproductive age, when it, she is married and has entered into the reproductive age, then the problems come. Number one, the most common problem is of the infertility. Why infertility? Because egg is not forming. So it's a paradox. In PCOD, there are many eggs, right? They have a necklace pattern of eggs. That's what is known as polycystic ovary. But a mature egg is not forming. None of those eggs is maturing enough to form a baby. So that's why infertility happens. And even if the woman conceives with treatment or otherwise, then the chances of having a miscarriage are high. Chances of developing diabetes during pregnancy is high, because pregnancy itself is a diabetes precipitating condition, and this woman is already at risk for diabetes. Okay, so during pregnancy, such women should be very nicely monitored for development of diabetes by doing glucose tolerance test. And also during pregnancy, chances of development of high blood pressure are high in these women. Okay, so let's say she has completed her family and now she is in 40s, 50s, 60s. Now we assume that maybe the effects of the PCOD would be gone, but no. PCOD affects a woman from adolescent till menopause, till throughout her life. So we really need to understand this disease, and it is so common. So during the post-reproductive phase, or in the 40s, 50s, the chances of developing diabetes in such women is 5 times higher than general population, and chances of developing heart disease or cardiovascular disease or heart attacks and stroke is 3 times higher than the general population. Okay, and the third very scary thing is development of uterine cancer. That is the cancer of the endometrial lining or inner lining of the uterus is definitely more common in women who are suffering from PCOD when they are about 45, 50, 60 years of age. But it is common. Good thing is that if we know about this disease, we can prevent all these things. So prevention is available. We can prevent diabetes, we can prevent heart disease, we can prevent cancer. So about the investigations, what tests to be done, what your doctor will advise you, and what is the treatment that should be given age-wise to the PCOD, we will discuss in the subsequent videos. I hope this video must have helped you in understanding this disease a little bit. If you have any questions, you can write down in the comment section below and I would try to answer them. And thank you so much. You can like and subscribe the video, and please press the bell button so that you can get our notifications regularly. Thank you.